Mike, why don't we begin by your telling us what issues led you and your board to make health and wellness a really high priority at IndyGo?
Well, first, thanks, Doug, for having me. This is a great opportunity to kind of share our Indianapolis IndyGo story. I took over as the president CEO back in 2008 and became the full in 2009. I had been here a few years before. So from our board and from our administrative side, it became very apparent that we had an unsustainable healthcare cost issue. And from there, we started digging into what was going on. And I think many of us in the transportation industry know that issues of obesity, diabetes, hypertension are factors that relate to productivity and absenteeism. So we started digging in, and it really hit us smack in the face when we were starting to see less responses to our healthcare RFPs when we're asking for healthcare providers to write our book of business. And our loss ratios were just out of the ballpark. We were in over 110, 115% annual loss ratios, unsustainable. Yes, and it was something that we were seeing a projection from one of our healthcare providers of about a 44% increase in our healthcare premiums for the program. Now, to frame this a little bit, in our contract with our collective bargaining agreement with our union, we have to negotiate the plan, not just that we're providing insurance, but the fact what are the coverages. So part of the problem was we had no deductibles. So there's no personal investment, no personal responsibility that people had for their own health and wellness, and that was a problem. So that was something we had to negotiate through, and we actually had to go to arbitration in order to get even some deductibles put into our program. But at the same time, we were able to incorporate a participation incentive for a wellness program. So we recognize that we needed to improve the health and wellness of our employees, our team members, and their families as well, their dependents. And so we started off looking at what does that entail. An on-site primary health care clinic was discussed, even in kind of an occupational clinic format, and a program of wellness that individuals would be required if they chose to participate, because there was financial incentives to participate, where we were willing to pay 85% of healthcare premiums if they were actively participating in a wellness program, which we defined what active participation meant. So leading to what does this all look like? And we work with an insurance broker who worked with both on-site clinics and wellness programs and our insurance providers, and trying to come up with a strategy that would lead us to, again, the health and wellness of our employees, number one, improving productivity, reducing.
Quickly, Mike, when did your board get engaged with you in this? Was it early on, and did you have special work sessions, or how did that happen?
It hit them smack in the face when we're talking about our budgets. And that's when it became, even though we'd been dealing with the operational side of issues, but from a financial side, that's when our board probably became much more in tune and just more or less directing. So we didn't have sessions away, but we had committee meetings, and they understood the challenges. I think the challenge for them was, so what was it going to take? What can we do to start turning this around? And they know from the union contract there were negotiations and approvals that they would have to be engaged in, but they had to understand, and they did, that this was not an overnight solution. This was going to be a multi-year approach to have a pathway to, one, improving the wellness and health of your workforce and dependents. Two, you want to have a more responses, more companies who are willing to write your insurance business, which we were basically locked into one who was even willing. And the third was the hope would be eventually that we could go to a self-insured program. We were primarily a third-party pay system, where if we go to a self-insured, which of course has the excess insurance, the cap, so you have protections on the high end, but you are setting up a system where you incorporate now your clinic and your wellness program with your insurance provider, and it's an overall healthcare cost program. And that then we can capture, I think, considerably more savings. We haven't gotten to that point yet with the board. I think we're showing a lot of progress, but I think there's the tentativeness, just the term self-insured, and maybe some of that's just not fully understanding.
Okay.
So kind of moving forward, we entered into, we started off with an occupational health on-site clinic, and then with a wellness program that had different steps, health risk assessment, drawing blood, annual physicals, coaching sessions, individualized. And I've got to state here that everything that was done is subject to HIPAA and the protections of our employees and their health. We as an organization don't know and don't want to know anything about those individuals and their health. All we see are statistical information to help us guide us on decisions about what programs and policies we need to put in place. But and that was a concern because some of our employees, there was pushback and concern about, well, you're just going to learn about our medical issues and then you're going to fire us. And furthest from the truth, we wanted them engaged. That took several years to gain that final trust, and we even switched our model over when we went to an on-site clinic where workers' comp and the occupational wasn't part of our clinic. We didn't want to get into decisions of our healthcare provider on site to be able to make decisions of whether the person works or not work, because that was a wall, a barrier that employees felt like, I'm not going to go in because they're going to take me off work. So that's where we've evolved over the last several years, where right now we have a primary healthcare clinic, a doctor, nurse practitioners, med technicians. They're dispensing from pharmacy. They are doing well child checkups, and it's what's happening is our loss ratios our last several years are under 100%. The first year we were able to get down to about 89% loss ratios. We had a 4.5% reduction in our health care costs. And we've steadily seen reductions or holding the line on our cost of health care programs. And that's attributable to the improvement that we're seeing in the health and wellness of our employees. The fact that through pharmacy, individuals now through their coaching and their visiting with the doctor on site, well, they're taking medicines on a regular basis. So pharmacy costs may be up, but what we're seeing is individuals for whatever it could be, hypertension or diabetes, are taking their meds on a regular basis. That's a good news. Visits to emergency rooms, which are very costly in healthcare programs, have reduced considerably. The utilization of the clinic, Dr. Molly is the doctor for probably 60% of our employees now, and that's a huge, knowing that probably there's a number of individuals who were not even seeing doctors or had a primary health care physician that they were seeing on a regular basis.
So are there any other impacts or results you've seen? It sounds like it's really paid off for you, both from a cost perspective and wellness perspective.
Yeah, and we're growing as an organization. We're fortunate that in our city, our citizens have elected officials willing to raise our income tax to help support the growth, a 70% growth in our transit system. With that comes hiring new employees, and already almost a full employment market, very challenging. So in the transportation industry, we require CDLs. So we're doing CDL testing, which is now our CDL physicals. That's been an expedites, as well as allows us to as an organization, attract individuals and run them through our system on the hiring basis too. It gives also that opportunity to engage immediately with new hires, that introduction of here's an on-site primary health care clinic where you and your family can come, and getting people engaged more quickly. So a lot of positives that are occurring. The wellness program as well, and so it's not just the clinic. They go hand in hand, where the wellness are ones where people are getting individual coaching, and it's just their specific issues off their health risk assessment. And you start seeing the successes of things like weight management. When you have an individual who comes up and gives you a big hug and says, I've lost 65 pounds, and you're like, oh my gosh. The Weight Watcher program that is in place, activities where we have walking groups, where you have community activities that people are starting to respond to and participate in, and maybe it's a walk or a run, but those are activities that can only manifest itself in better relations throughout the organization between employee management, employee to employee, and the employees and our organization to the community. So those are some positives.
You might have mentioned this, but if so, I missed it. Do you have a gym or a fitness kind of facility as part of this?
We have not incorporated that. We've looked at that. Space is always a challenge. We have indoor informal walking. We have 8.5 acres under roof. So we have employees who will have, you see them in the onesies, twosies, or foursies, if you will, walking around. Either, fortunately, we're in an area that has some good walking paths, but internally even, where people will be taking breaks or lunchtime and doing their walking. But we do have discounts for gym memberships, which has been part of our our program. So there could be fitness clubs or the YMCA that we've been able to negotiate, and that allows then our coaches, the healthcare wellness coaches, to be able to help individuals, point them to fitness programs that they're able to go to. And it's not just the physical fitness. There's also your emotional and mental fitness. Stress management is important. We will host lunch and learns and different employee seminars to help individuals about, maybe it's financing a home or a car or retirement, or to talk about stress as it relates to just your family budgets or what's going on. Of course, we have an employee assistance program that's available to refer individuals to in more acute issues, but in more general, it's physical health, it's their mental health as well.
Well, who on your executive team is responsible for this overall health and wellness trust? Where does it fall in here?
Our human resources department, and which reports the vice president reports directly to me, and that's I feel very strongly about this whole program. And so they're the ones who are managing the contract. This is the contract is with a private carrier. It's called Activate Health that we utilize for our clinic and the wellness coaching. It's a combined effort. And then, of course, working with the outside third-party program right now. We're using Anthem, which is the Blue Cross Blue Shield provider in our city.
Now, you've obviously moved pretty far on the health and wellness front at IndyGo. Looking ahead, what's in the works? What's your thinking about next steps?
Well, that's a great question, because it's some of the things that we're kind of focusing on now as we one, wellness participation and the coaching sessions as we've grown, we want to really maximize. We want those individuals through their health assessments who are doing well, and maybe they don't need as many coaching sessions because it's time consuming for them as well, but you want to check in. So being more efficient there, where we can have the resources being more targeted to individuals and their family members who have maybe some significant or health issues that or things that they want to address to improve their health. So the focus is going to be on the high or moderate risk issues that we're seeing, and on the dependence. And I think that's one of our I would say, a target-rich environment where getting to the dependence, and this is a challenge in any business, is communication and getting information out. And it's, by the time you feel exhausted of communicating is about the time individuals are starting to get it. But reaching family members is a real challenge, but we're focusing on that. So one of our opportunities here is working with Anthem and working with our Activate Clinic and the wellness program to share data, and that was a real challenge. But to getting now agreements where data sharing so there can be more coordinated, and having our Activate Healthcare Clinic be one of the primary care physician offices that could be utilized under the Anthem program. But by sharing the data, it starts now setting up and identifying those individuals, and some are direct employees and some are the family members, where we can target, and I'm using we in the sense of what the clinic can do, targeting the coaching at high-risk individuals, and sitting down even with reaching out and talking with them. You have family members who may be seeing multiple doctors, and they're receiving multiple medications and the contraindications that occur with medications because they don't have somebody who's their advocate and can sit down and help them with issues of medicine control, as well as diet and exercise, and helping them on a path. And it's that accountability. And kind of back to my earlier comments, personal accountability for your own health is something we're trying to instill in all of our employees and their family, that they have control. It's not a matter of having, I've got a great health care program, it's very rich, and I'll just have the health care keep paying the program. I don't have to worry about the cost of a colonoscopy or cost of a medicine. I've got to take a personal responsibility for what I'm taking and why I'm taking it, as well as the cost as well. So those are things we're focusing on. But increasing the employee engagement, we're developing an internal marketing program. We have a wellness committee continuing to empower those individuals. And as I said, the disease management is where we're really trying to target those individuals who are probably the moderate to high risk. And it's kind of like smart bombing. You're not prophylactically going after everybody. You're now starting to identify those individuals that, one, from a cost standpoint, or the high rollers, if you will, in your healthcare program. And every organization has that. But to do it in a way now we can help those individuals hopefully start moving towards a healthier life and lifestyle.
Now, who's on the wellness committee? How is that constituted, and what do they do?
It's throughout the representatives throughout the organization, different departments. These are employees. Some are in management roles. Some are roles that could be mechanics, or professional coach operators, just throughout the organization. And they help give feedback, but also they're your ambassadors who can be out and talking to individuals and learning more. Surveys are important. Helping to identify what resonates with our employees as far as activities that we'd like individuals to participate in. And also, it could be as you think, minor, but it's not. What's the food in your vending machine? The feedback that you get to say, gosh, what we got in there is crap, and here you're teaching me wellness and helping with our eating, but you put these high sugar, high fructose carbs in our vending machines. We want healthier choices in that. So even that is something important. And in fact, I think out of our wellness, one of the things we learned is nutrition. And we have contracted with a dietitian now. And so a dietitian now is to help individuals to talk to them and their families about what's a good way of preparing foods, getting more of the fruits and vegetables and fresh items versus In our industry too, we're grab and go. Our employees, and most of those who are frontline or professional coach operators, their shifts are crazy, their hours are crazy. They have family members. They may grab fast food in between their work shifts, or they may be grabbing food to take home, and a bucket of KFC is because it's quick and easy, and I got to get back to work, or it's late, eating late. A dietitian hopefully can help at least start talking about choices again and what a family can do, and helping people. People want to do the right thing, equipping them with information and encouragement, and kind of helping them, being an advocate for them. And so a dietitian, your health coaches are all important.
Does your wellness committee connect with the board in any way? Does it
through our
committee of the board, or what's the?
Not really. We have a 7-member board. They are appointed by our city council and our mayor. They are very engaged. They ask a lot of questions. They're kept informed. They're not active in the sense of into the organization and participating in committees directly that we might have. Although we're going through a strategic planning process, we know what we do as an organization. We have our plans over 5 years of how we're going to implement, what we're going to be doing with growing the system by 70%. But what's the culture? Does everybody know their role? And are they positive direction and engage in how we deliver that service? And that's where our board is playing an active role in that process right now as well.
I assume they've been very supportive of what you're doing on the health and wellness front.
Yes, they are. I mean, of course, they understand the intrinsic. Yes, we're getting a healthier workforce. We're bringing people into the fold, into the family, and starting them off with taking care of yourself. But they also like the financial side. And that's kind of back to where we started. This was an unsustainable problem of increasing healthcare costs in double digits, where we are now. Yes, we're growing the number of people, but the percentage of the premium increase has stabilized, where we haven't had an increase over the last several years with the plan that we have in place. And I would challenge many businesses to say, okay, so how's that working out for you? It's in this world now with the Affordable Care Act, or wherever national health may be going, or and we had to be careful with Cadillac issues. Did we have a Cadillac very rich program? Those were challenges that we put in place, but the fact that we were moving towards initiatives, and it did sit-downs with the executives at Anthem to say, here's our commitment. Will you be our partner? Will you commit to sticking with us? It's going to take a few years. And that occurred. And they were willing to negotiate with us and cut in half a huge increase the first year. And then they've been a good partner throughout for the last 5 to 6 years.
Well, you've obviously launched, and I think you said this goes back, 10 years or so?
Just about.
Roughly. A very comprehensive, extraordinarily innovative approach to health and wellness. When you were developing these various initiatives, were there any transportation authorities around the country you looked to as possible models, or did you pretty well have to go it on your own? Come up with your own?
There may have been. Our HR exec would participate in the American Public Transportation Association HR committees, and even my conversations with counterparts around the country. I think a lot of it was kind of commiserating with healthcare costs. That's a big challenge for us. And each of us have, in the transit world, have generally contracts with our unions that, and some are more open than others. Ours, unfortunately, said we had to negotiate the plan versus as an employer saying, here's our plan. So we kind of just started taking the bull by the horns and looking at our organization and our employees and the relationship we have with our union and our employees, and to say, how can we collectively move forward? And it was a push-pull to finally get individuals to say, okay, the management, the business is actually trying to help us, and we're not out to find information to fire people. We are truly interested and need them to invest in the program, and it took several years to finally kind of get there, and there are tweaks to the program. You evolve, and as you learn more, and we had a separate wellness program, and then we had a separate on-site clinic, and we finally said, we've got to have merging of this, and then we said we've got to get our healthcare provider more engaged as be a partner in this. So it's kind of a three-legged stool between our clinic and wellness program, our third-party insurance provider, and our corporation and employees as a whole. We all need to kind of collaborate and work together, and we're showing results. Still ways to go, because personal responsibility is still a key issue here.
The next horizon, so to speak.
Yeah.
Well,
yes, it's a constant horizon.
You've obviously blazed trails. The initiatives you've launched sound extraordinarily innovative, and I'm sure transportation leaders and other nonprofit and public leaders around the country will learn a lot from what you've done. I want to thank you, Mike, for taking the time to tell us about what you've done at IndyGo on the health and wellness front.
Oh, thanks. Appreciate the opportunity to just share a story.
And I appreciate your time, and I wish you a good afternoon and rest of your week.